Welcome to the webinar called Business is Personal, Maintaining Human Connections in a Digital World. This morning's event is sponsored by Cbts, Hawaiian Telecom, and Hawaii Business Magazine. Aloha, I'm Steve Petranek, editor of Hawaii Business. Though so much has changed in the past year and a half, one thing remains the same. Human connections still drive business. In today's discussion, we'll explore how successful local organizations have adapted using technology, and we'll focus on ways that you can use technology to strengthen personal relationships and connections with customers and employees, even if you're not in the same room. We have set aside time for your questions in the last part of this webinar, but we welcome those questions at any time. Use the Q&A tab at the bottom of your Zoom screen. Let's hear first from Jamie Kawamoto, Executive Director of Marketing and Communications for Cbts Hawaiian Telecom.
Thanks, Steve. Aloha, everyone, and thank you for joining us today. Today's theme of maintaining human connections in a digital world continues to be extremely relevant as we all navigate our ever-changing reality of living and working in a pandemic world. Adapting to COVID has been different for everyone, but what has remained universal is the importance of our connections and relationships with one another. As physical in-person interactions continue to be limited or modified, technology is really working overtime to bridge potential gaps. At Cbts Hawaiian Telecom, our goal is to be the leading technology provider that local businesses can look to for support and solutions. For those not familiar with the Cbts arm of our company, it is a leading service provider to more than 3,000 enterprise clients across North America and launched in Hawaii early last year. Our mission at Cbts Hawaiian Telecom is to connect and empower Hawaii. This applies not only to providing crucial connectivity and support to our customers every day, but also to our employees. Like many of you, our workforce transformed overnight, and the majority of our employees continue to work remotely today. And while I think we've all become very accustomed to virtual meetings, it seems like it's really the teams and the leaders who continue to adapt how they use the technology, who continue to have the most engaged and productive employees. So a personal example, while the execution might be different, our team has found it important to still put the same thought and intention into celebrating milestones. Things like having pizza or cake delivered to the celebrant during a virtual staff meeting so we can all experience the joy of the birthday surprise together. Or another fun thing, we started a You're Talking on Mute jar where we chip in $1 every time one of us talks on mute. And I'm going to match the amount at the end so we can soon have an epic pauhana together. From a company perspective, we're currently in the process of rolling out a PAL program, so peer assisted learning, where new hires are assigned a buddy in a different department to help them onboard to the culture and those nuances outside of their functional work. These examples don't work for everyone, but ultimately it's about fostering relationships in whatever way suits the personalities on your team and your company culture and values. So I'm looking forward to learning more best practices and helpful tips today. Thank you to Hawaii Business for hosting this important conversation. To our panelists for sharing their expertise with us today, and most of all to all of you for attending. Mahalo. Now I'll hand it back to Steve. Thank you.
Thank you, Jamie. I love that idea about the mute button. We'd have an epic party at our company if we had that rule. Let's do a quick 3-question poll. And I'd like everyone in our audience and panel to participate. You can see the polling tab at the bottom of your Zoom screen. First question, in a typical day, how often do you do video calls? Is it 7 to 10 times a day, 4 to 6 a day, and 1 to 3? Or I don't do video calls, which would definitely make you an outlier. So those are I'm gonna select 1 to 3 because I don't do a whole lot, but I do them. And go ahead and select your options. So, Lauren, where am I seeing the responses? Let's see now. I apologize. This is the first time I've done a poll like this, and well, there we go. Okay, I'm in the majority. Most of you are doing 1 to 3 calls a day. My sympathy to the 6%, is it 8%? Sorry, my eyes are not good. It's 6%. 6% doing 7 to 10 calls a day. And the 4%, I don't do video calls. Well, good luck to you. That may change. Okay, let's go on to the second question. What percentage of your employees do some work from home? And think of your company, your organization. Is it 76 to 100% working from home? Is it 51 to 75%? And we've got 26 to 50% and less than 25% or none. So go ahead, and we are currently right now at that high range where we're going into the office maybe 1 day a week and not even every day, every week. So I'm going to hit 76 to 100%. And let's give you a few seconds. Make your best estimate. You probably, unless you're the CEO, you may not have exact numbers, but make an estimate of what you think is the best percentage for that. So we're compiling those results now. Please participate if you can. And Lauren is working on compiling those results. We'll give it another second. There we go. Again, it's the highest percent. We don't have a majority. The plurality is the highest range, 76 to 100%. So in the people in our audience, and of course, this is not a scientific poll, but it's I think there are a lot of companies that fit that top range where most of their work is done remotely. And then we've got a smattering from each of the other ranges. So excellent. Thank you for sharing. One last question for us, and that's about the near future. Going forward, will your company have work from home options? 3 possibilities. Yes, we're giving employees the option to work from home. No, we're requiring employees to be in the workplace, and that would be all or most of the time. And then the third option is hybrid. We're going to allow both work from home and at work options. So please select that answer that's best for you. I'm going with hybrid. And there I go, submit. So this is knowing that things may change. Who knows what's going to happen? The pandemic has come back strongly, so we can't predict the future exactly, but I'm pretty confident that we will have a hybrid model, having talked to our CEO and other leaders of our organization. So we're compiling results. There we go. Ooh, most everybody is hybrid. 84%. So that's the most extreme example in our poll. Only 10% are going to require employees to be in the workplace, 6% giving the option. So thank you for participating. Useful information to know as we begin our discussion. So thank you for participating. Now let's meet our panel. C. Kimo Alameda is the PhD, is Chief Executive Officer for Bay Clinic, which provides healthcare to people on the east side of Hawaii Island. Brian Cooper is the Vice President of Information Technology for the Sullivan family of companies, which includes the Foodland grocery stores. And Jordan Silva is Senior Manager for Service Delivery at Cbts. Brian, I want to start with you. The Sullivan family of companies saw challenges in their tourism-related divisions and some other areas during the pandemic, but enjoyed expansion and strong sales in its Foodland grocery division. How did you change or increase your use of technology to navigate the many changes you went through while maintaining those valuable connections with customers and employees?
I think the biggest thing that we did is we really increased our e-commerce locations. So we know that people, didn't really want to go into the stores. They wanted to keep their distance. I think we had about 2 stores at the beginning of the pandemic, and we ramped that quickly up to about 15 in about 2 months. And I think the customers really appreciated that. And of course, we really stress customer service as a point of difference with Foodland service. So we also made sure that we have like a call center that would do follow-ups and really be hands-on with the customer, so they felt like they were getting the same level of customer service they would if they went into our brick and mortar stores, but now they had the option to do it online, pickup or delivery.
Yes, I remember those, and they're still there. The reserved parking spots right close to the store that allow people to pull in and pick up their stuff. That's great.
Yeah.
Chemo Bay Clinic expanded services and locations during the pandemic, which meant more patients, more employees. Tell us how you use technology to support your expansion and maintain connections with all of those people.
Absolutely. First, thank you, Hawaii Business and Hawaii Telecom. This is a great opportunity to share with folks. Even in the health sector, Brian mentioned, customers not wanting to come into the supermarket. Well, we had a lot of patients who didn't want to come into the clinics either, for fear of getting COVID. So we had to, and technology was the answer. Anywhere from, making patients feel at ease with our air conditioning system, letting them know that we had like this system that it kills 98% of the bloodborne pathogens, if somebody sneezes. So that, and then, all the way to fever kiosks. When you walk in, you get a fever kiosk and it prints out a sticker that's saying, "Hey, I'm good to go." And other patients are seeing that sticker and it's alleviating their concerns, right? And then of course, telehealth. Just like everybody else, trying to figure out, how can we get people to not come to the clinic and utilize telehealth from the convenience of their own homes. And so, but that took a lot. But in doing that, we surprised us that we actually expanded services where other health centers were actually either closing their doors or decreasing services. We ended up expanding services with the utilization of telehealth. We kept our clinics because we had technology to assure patients that it's safe. Of course, we had all the safety protocols in place too, with the proper PPE and sanitization practices and all. So we got 8 clinics. We opened up another clinic. We utilized a mobile unit, which is a clinic on wheels that we would take to different places at places like homeless shelters, places where elderly housing complexes, and basically provide services on the site. So, and with the whole vaccination effort, we've been out in East Hawaii, just all kind of different places, the Hawaiian homestead areas, Makuu Farmers Market. We went out to Na'alehu. We even went to Miloli'i. We took generators. We had special Wi-Fi, and we set up a clinic in Miloli'i, which is the oldest fishing village, in the nation. And we were able to provide a vaccination event there. But without proper Wi-Fi connection, that wouldn't be possible. So yeah, it's interesting, but it's been a mixed blessing for us. And with the Delta virus now, we're primed. We're primed in being able to respond. And so we're in a pretty good situation right now in terms of responding to this second, third, fourth wave, if you will.
Well, and those precautions you took and those assurances you made to your customers, your patients, were also reassuring to your employees too, because it helped protect them also.
Mm-hmm. Absolutely.
A follow-up question. You have just completed a year plan for Bay Clinic. How do you how does tech and the connections that tech creates fit into your 3-year plan?
Yeah, so, first hats off. I mean, Hawaii Telecom has provided, every time we've called, they've been there to provide on-site maintenance. They've also helped us to increase our fiber network so that we can connect from one, because we got 10 clinics, including the mobile unit, and the mobile unit has laptops in it, right? So, and our docs, every time they finish a patient visit, they got to document in what's called the electronic health record. And that got to be, and so we need to have the fiber networks connected so that it goes to our server, so that it's all, HIPAA compliant and all. And it wouldn't be possible without the support from Hawaiian Telecom and the expertise, to be honest, because this is, it's kind of new territory for Bay Clinic to be expanding. I mean, in this way, right? I mean, we have a clinic all the way in Na'alehu, and the big concern was connectivity there. Can a doctor, input, progress notes there and save it back in Hilo, and is it secure? And do we have backup, in case, because we're actually in tidal wave zone in Hilo, we're close to the ocean. So it's like, if anything happens, like, do we have backup? Does the server, because we're not in the cloud yet. So, and the expertise that Hawaiian Tel brings to the table is great, because it allows us to create a 3-year plan with all of those contingencies and mitigations in place. And so again, yeah, technology is where it's at, and without that, we couldn't expand, and we couldn't assure our board that in the next 3 years we'll be okay. And because of technology, we will be okay.
So it's definitely not do-it-yourself technology.
Right.
Thank you for sharing. Jordan, what services are the business clients of CBTS Hawaiian Telecom using more often since the pandemic began to maintain those connections with customers and employees?
Sure. So there's obviously been a pretty large uptick in anything video conferencing or chat related. Prior to the pandemic, we helped a lot of customers implement things like WebEx from Cisco, but as we kind of move through this and people realize that there's more to connectivity than just being able to talk to someone or even jumping on video, you want to be able to collaborate and share information. We're seeing a large uptick with things like Microsoft Teams. We're a big Microsoft partner, so we use it internally. We help customers kind of implement solutions where they're able to not only see each other and talk face to face and chat when they need to, but also share documents and collaborate on what they're working on. And any tool in line with that helps a lot, right? It keeps the information sort of flowing between groups. You can build out chat rooms for your individual teams to talk to each other. And it's not the same as being in the building with each other, but it's definitely better than having to expect someone to pick up a phone and call one other person and talk with them. It gives that little bit of a team feel and more engagement at that level. So a big uptick in solutions that are decentralized, cloud-based, let people work from home, from wherever they are on an island so they can get back. And that data is then in a secure location that gets backed up, and it reduces the risk for the company. You don't want people saving stuff on their home laptops or their home desktops and things like that. So any technology that helps kind of resolve those issues has been pretty popular.
Cool. Hang on to that microphone, Jordan. I want to ask about the tricks and tips and other shortcuts that simplify people's work process so they can focus on their customers. You mentioned a few things about how you've made it easier, but maybe there's other things that just make people a little less stressed out and more effective and productive in this current environment.
I think a lot of it goes back to, and this isn't necessarily technology specific, but technology has helped a lot in the implementation, but simple things like documenting what is supposed to be done and really understanding what you want out of a process has been really important. For a long time, being in the office meant that you can kind of see what somebody's working on. As a manager, it was easier for me to just look over and see who was at their desk and be like, yeah, okay, it's getting taken care of. So-and-so's at their desk, it's good to go. When everybody's remote, there's a little bit of stress and anxiety from a management perspective to make sure the work is getting done. But employees also feel that stress and anxiety. They want to make sure that, people know they're being productive, and, they don't want their managers to think that they're not doing anything at home, that they're just sitting at home watching TV. So they feel this stress too. So making sure everybody understands what's expected and what good really looks like from a position in a way that's objective and not just reliant on you seeing them at their desk has been helpful. Implementing tools like SharePoint that can help with workflows and and sort of visualizing where tasks exist or other task management solutions. So everybody can be on the same page about where something is or where a project is and what the holdups are or who's responsible for the next steps. That helps keep everybody really engaged and lower that anxiety. That way you're not basing your opinion on productivity of who's in their chair, but what's happening with the work you expect to get done. And you're able to really understand that stuff. And then just writing all those like processes and procedures down. Like if you expect something to happen, make sure it's jotted down somewhere and people know where that stuff is. So if it's ever confusing, everybody can kind of reference it. I have a pile of folders that are full of what they're just called swim lane diagrams, but they kind of do that. They break it down by role and what's expected from everybody. And all of my teams go through that. And anytime there's a hiccup, we have a quick reference. We can say, hey, where did we sort of drop the ball on this, or what crack did this fall into? And utilizing that type of technology helps really keep the stress that remote work can impart on people down a little bit and keeps everybody engaged.
It's nice to see that the technology and the very human parts are connected, because what you just described is definitely a hybrid of technology and people, and we have to make sure those two are aligned. A reminder for our audience to ask your questions using the Q&A tab at the bottom of your screen. Occasionally, I'm going to be looking to my left. I see there, we already have one question in. I'm going to get to that in a moment. We're going to have time for that, but I have a few of my questions for our panelists. I want to ask the next one to Kimo and Brian, and let's start with Kimo on this one. How do you keep your employees connected? You talked a lot about patients, doctors, a lot of things, but employees connected. I think you said 10 locations, including that mobile location. How do you keep your employees connected, engaged across your many locations without daily face-to-face, in-person meetings?
Oh, I mean, yeah, you had the survey question on video calls. So we do a lot of those. And it's good to see people's faces like today, right? Also, we do Zoom. Zoom's become a friend of the family. And we've been doing it 2 or 3 times a day. So, and it's going to be permanent. My guess is I'd say 80% of the staff like it. One, because we cover half of the island, and Big Island, you can put all the islands on the Big Island, right? That's how technically big we are. So we get geographically. I mean, you save a half an hour on the road through a Zoom meeting, and protect the environment, and all of that, and don't have to worry about traffic and all. So we keep connected through Zoom. We have ongoing what's called staff huddles. So we huddle on Zoom just like this. And we also have, believe it or not, we have virtual potlucks on Zoom as well. And it's cute because it's like the wine at 5. We do have something called the Blue Zone movement here on the Big Island, and we try to take care of ourselves, and socialization is important. And it's tough because the COVID situation again has now put us in isolation, right? So and so it's to be honest, we had this conversation yesterday. It's like so we could meet because we have a conference room that can hold 20. So we're all in the conference room with our mask on. And we're like, hey, we could all go back to our cubicles and see each other's faces. Like, what would you prefer? And it's funny because half of them was like, I think it's more engaging if I see how your mouth moves versus just seeing your eyes. I can't see your so it's almost like I think this is more engaging than being in a conference room and everybody's covered. So I got to tell you, yeah. So that's how we've been connected, and we actually have, like I said, potlucks through Zoom like this. So thank you for asking, Steve.
Thank you. Brian, how does your company keep employees connected and engaged? It's spread across so many stores all over the islands.
Yeah, we definitely have increased our use of Microsoft Teams for our meetings. One of the things that I think that we didn't have a lot of use of before the pandemic, but is like rampant now, is the instant messaging. Because now, since we're not all in the office, you don't get those kind of drive-by conversations to kind of get updated on different things. So now we really encourage people to just send, shoot a quick message, and it can even be a little group chat that just to make sure everybody's in a loop of what's going on. We're a Blue Zones company as well, so we do the wine at 5, and You can pop in and out. If you want to have your favorite adult beverage and just kind of hang out with everybody, then you can do that. We also encourage people to post healthy pics of their lunches that they're doing. Because that's another thing with the pandemic is everybody wasn't eating as right as they should. So just encouraging more and more community kind of things, but in an online fashion. I would agree with Chemo too. Yeah, seeing a bunch of people in masks and you can barely hear their muffled voice is not that great of an experience. So we end up doing a lot of stuff on video as well. But we try and do as much non-work events through these means as well, since we can't gather together in big groups anymore.
That's wine without an H, wine at 5. I've worked at some companies where employees would immediately think it's wine with an H, and that's what they would be doing at 5 every day. But thank goodness we're talking about that colorful beverage. Brian and Chemo, and here's another question for both of you. The pandemic has made things very stressful for everybody, healthcare workers especially, but I think for all of us, the grocery store employees, they're out there. They never got, they were essential workers, so they never stayed home and worked remotely. Brian, when people feel isolated and they're more susceptible to burnout, simply leaving a company, how do you and your team, what have you and your team learned about balancing productivity and burnout in the pandemic world, keeping people safe, keeping them productive, but avoiding from turning them, into burnout cases?
Yeah, that's really interesting that you talk about that, because that's something I think that a lot of companies are facing right now. And really, it's just encouraging people to have a balance. One of the things I think when the pandemic first started and people did remote work is everybody thought, okay, well, people would be less productive, but it turns out people were working crazy hours, weekends, and way more than they should. They went from a very structured environment where there was really defined boundaries of time of, okay, this is when I'm at work, this is when I'm at home, to now it's all intermingled. And that's hard to get used to. So we try and encourage people to make sure you're very deliberate about, having a space set aside at home to do all your work, and don't mix that with your places where you relax, like in your bedroom, if possible. And to really just make sure that you're taking care of yourself. We had a period where no one was taking any days off, because everybody wanted to make sure that they were still contributing, but you really do need to make sure that, hey, take your days off that you can, just kind of unplug and not be on call 24/7 and, answering text and emails and whatnot, just to really give yourself a break, spend time with your family. Even though, with the kids doing school at home, you probably don't want to spend time with them anymore, but you gotta, try and spend some time, some quality time together, having fun, maybe go out to the park or whatever. But we would just really encourage people to do that. And from a management side, we would try and set an example of, we'll take a day off so they can feel like they can take a day off as well.
Yeah, that's important that you said it. It's don't do what I do what I say. No, they have to align, and the C-suite to make sure that those things align. Yeah. Chemo, your thoughts on balancing productivity and burnout in this world?
Yeah, for sure. When the COVID first came out last year on March, I remember, nobody was coming to the clinic, so we had to do a kind of like a layoff. We basically did furloughs, and that was tough for folks. But then the PPP program came in, and we brought everybody back. And that allowed us some leverage there. So at some point we just had to say, hey, right now you got to take care of yourself, right? It's not about productivity, and we know we got to make ends meet on this side. But the federal government for health centers were great. I mean, they, Biden administration most recently just gave us a lot of wiggle room with funding. So that allows us to tell our healthcare workers who are, they're burning out, especially now with the Delta virus. Shucks, we thought we was kind of in the clear pretty soon, and then this thing just kind of came up. So now more especially we're encouraging them to to be safe. If they have any kind of symptoms, stay home. It's okay. And if you don't have PTO, if you ran out of PTO, we got your back, right? Because I think they got to know that we support them. And the extra funds that we had did allow us to give a mahalo bonus. So we gave 3% of everybody else's pay, just extra, just to mahalo them for being in this, in what I would call kind of a risky environment, right? And we had a on-site get together. This was before, about a month ago, when it felt like, hey, we're vaccinated and we can be outdoors with masks and we're fine. And we had a mitigation plan. We had the county approve it, and it was great. It was the first time that we gathered, and we had live music. We didn't do buffet type lunches, but we did. It was actually like a pre-dinner. We did like box lunches, if you will. So that kind of get together, that felt really good. I think that really lifted the spirits of all of our healthcare workers and our admin and the staff and folks who are working at home. So we got billers that we felt could work at home. The billing staff could work at home. We got a lot of folks, consultants, that they could work from home utilizing technology. But just bringing all of them together and seeing each other, like, we haven't seen each other in a group setting just like for over a year and a half. So that was nice. So that's the kind of things that we remind them. And then, of course, we got psychologists, so we got 18 providers, medical providers. We got 4 mental health professionals. We got a pharmacy. We got dental care. But the behavioral health department really stepped up to the plate and would look for signs of that kind of a depression, if you will, or, anxiety. And a lot of our therapists were providing that kind of support to their colleagues. And I just said, hey, that's great. So that kind of support, I think, in-house really strengthened the bonds and made us better for it.
Yeah, I wish I had invested in bento boxes before the pandemic. I would have made a killing.
Yeah.
It's really been a resurgence in the use of those. Jordan, what tools are available that maintain productivity and maintain productivity and maybe help prevent burnout? And maybe tools that make us efficient, but with less stress and less friction than before.
Yeah, what I like to talk about a lot when we talk about technology and helping resolve some of these issues is building efficiencies into the work we do, so we have time for the inefficiencies that come from relationships and managing all this stuff, right? If we can, be 10%, 20% faster at the work we're doing, we have 10 or 20% to give back to just talking to each other and sort of filling in the gap from not being able to be in the workplace. So tools like SharePoint are top of mind. Teams, anything Microsoft 365 related are very available. Google Apps, Google Workspace, that type of thing, because they just increase collaboration so much, and they make life a little bit easier. There's a lot of specialty tools out there. Obviously, Dr. Alameda's offices are going to be using an EHR software that will help manage their workflows. Brian's team obviously probably has some specialty tools they need to manage their type of business. So it would rely on the industry for specialty tools, but really just focusing on trying to reduce the workload. That way people can be inefficient when they need to be. That's what reduces burnout, is making sure we have the time to rebuild those bonds. In the office, and you can have those passing jokes that help build up your relationships and all that stuff, but without, putting in a specific effort or an intentional effort. I think Brian mentioned like encouraging people to send food pics in their instant messaging. For a long time, instant messaging in a business, it was kind of frowned upon to do that sort of stuff, right? It was instant messaging was for work only, email was for work only. People were discouraged from, dropping a meme in there when they thought it would be funny or joking around. And it's sort of the opposite now, where use that GIF button, send something funny to your teammate because we have to do it. That's the only way we can engage. So using technology and leveraging technology to give yourself more time to be people is probably the best approach. And not trying to automate the relationship. You can't really automate relationships. They're inefficient by their very nature. We have to just give them the time to build. And and making sure you're focusing your technology efforts on the work and then letting people be people with the spare time.
I love that. Don't automate the relationship. That's something I need to keep in mind, because I'm always about, the work and making things efficient. And I love that making ourselves more efficient on our work so we have time to build those relationships. Great thought. Jordan, another question for you. In the news, we're seeing a huge uptick in ransomware attacks. They're happening everywhere, small companies, big companies. At the same time, most of us are spending lots more time online. So it's the Zoom meetings, it's the WebEx meetings, it's online shopping, watching Netflix, making appointments. We're doing just about everything online. And what are the trends you're seeing in how companies secure their assets in that kind of world?
It's definitely scary. Everybody is paying attention to security right now. It's pretty much impossible to watch the news over the last few months without seeing some type of, giant ransomware attack or a large corporation being impacted. But businesses of every size are under attack. I mean, small businesses are hit every day with things like that. So we're seeing a lot of curiosity and a lot of questions coming from businesses of all size looking to figure out how to effectively implement security while maintaining their budgets. They're businesses, they don't have infinite funds. So it's about trying to figure out getting the most bang for your buck when implementing proper and effective security measures for a business. I think a lot of companies are also looking for more specialized security sets now. Previously, you would rely on your system administrator to sort of take care of a lot of this stuff, and it worked for a long time, but attackers are getting better. They're becoming a lot more sophisticated. They're getting a lot more fearless, frankly. And as a result, we're getting a lot of people reaching out to us to provide some specialty skill sets and maybe just giving an outside perspective of their network and looking at things from a provider's perspective. We're a large internet service provider, so our entire history as an organization has had a lot of security fundamentals built into it. It's something we've always had to sort of deal with. So we're allowed to sort of share that experience with companies who need the help now. And everybody needs it. There's no one that can hide from this type of stuff anymore. And that's unfortunate, but it's definitely where we are.
It's definitely not small companies are immune because you may have less security than a huge company. Maybe you're a smaller target, but they're going after everybody.
Yeah, I mean, the attacks are more or less automated to an extent. So, I mean, you could pop a server up onto the internet and within hours, you're going to see people attacking it. It's not a human attacking you initially. It's a robot. It's a script that's going through and hunting for potential targets that look a little vulnerable. And then a human might engage like a live attacker if the automated script can't break through your security. So and you just can't hide anymore because the scripts don't sleep, right? They just run around the clock and they're always looking.
Yes, it's scary. Let's be safe. Let's adopt safe practices. I'm going to jump to the audience questions a little early because we've got quite a few already. So let's take this one. I question: could CBTS Hawaiian Telecom help with helping companies set up these recommended tools like SharePoint, Teams, all these ones that you've mentioned, WebEx? So there's a lot of them there. Jordan, I think that one's for you.
Oh yeah, absolutely. We have a whole division that's specialized for implementing services just like that. We spend a lot of our time helping businesses not only implement networking technologies and traditional services like VPNs and firewalls. We have full teams for security offerings specifically. We have teams that help with things like communication platforms like Microsoft Teams, SharePoint, all the Office 365 suite. Definitely able to help.
Cool. Someone's giving a shout out to the Hawaiian Telecom team for outstanding service at the Kahala market. Thank you for that thought. Here's another one. It's about really small companies. You know, they let's say there's 3 employees, maybe a husband, wife, and one of the kids is helping out. They may think that they're too small for this kind of services, that you're only dealing with the bigger companies. What would be some of the recommendations? This company says they're already on Zoom and they love it, but other things that might be suitable for them.
Yeah, I think that one of the upsides to having so many tools available in the marketplace right now is that there's probably something available at every size. Tools like Microsoft 365 or Google Workplace have done a really good job of making their solutions scalable. So, I mean, my parents own a small business. There's a handful of them that work there, and I have them on cloud-based platforms because it keeps things simple. Things like backups, things like remote access to their tools and sharing documents. I don't have to worry about if they remember to plug in a USB drive to run a backup on a desktop or something. But those same tools are available all the way up to huge enterprises that use them. And that's the kind of scalability we look for in the solutions we try to recommend. Is we want things that are right-sized for businesses. Smaller businesses don't have infinite money. So being able to recommend a tool set that is easy enough for them to manage, that fits into their workflows, and that can grow with them, most importantly, is sort of the approach we try to take. But the same check boxes need to be checked. You need backups. You need some level of assurance that your data is encrypted and secure somewhere. You want to make sure that you have a good and reliable endpoint security product to make sure there's nothing running on your workstations that you know shouldn't be there. And there's really good tool sets out there for every level of business, for sure.
And this is related to an earlier question I want to answer. Where do they start? They make a phone call, they go online. How do they send you an email? How do they want to make that connection, hear what Hawaiian Telecom can do for them? What's the first step they take?
Any of those. You can go on our website. There's a contact us link that's there. There's a phone number that's there. I think at the end of this, when they send out the recap of this event, there's probably going to be some contact information. But any and all of those things work. We have a great sales team that's available that'll help sort of answer initial questions and get you in touch with an architect or an engineer who can help come up with a good solution for you.
Excellent. So yeah, look for that follow-up email. It'll be in your inbox tomorrow to make those sort of what next type questions easier to answer. Here's another one from an attendee. As more and more of the water cooler type conversations move online and are documented and retained, is there any concern of what may or may not be available to be used in litigation? Ooh, okay. Good question. Before the pandemic, there were corporate initiatives to restrict what official company communication was documented by email or in writing versus in person. But now if we're doing it on Zoom, for instance, this Zoom event is being recorded. We're going to post it on the Hawaiian Telecom site and on the Hawaii business site, so you can watch it, recommend it to your friends and colleagues. Wow, anybody want to handle that one? That's a legal issue, so you might not be able to handle the legal implications, but yes, all those recordings where you may be speaking out of turn, are they being recorded? Can they be used in a courtroom? Can they be used in like a harassment case? In the lecturer in the office used to hang around the water cooler and maybe do inappropriate physical things. Now, are they doing inappropriate things online?
You know, I don't want to answer from a legal standpoint, but I would say for us, we just relied on our handbook, our employee handbook. So pretty much whatever the behavior is that you would do in the office, that's what you should be doing online. In the beginning, I think I took pains to make sure that people realize, hey, you need to watch what you're saying, make sure, because there's a record of all of this that's happening. You know, so just use your good judgment. You know, there you can throw a like Jordan said, a meme in a text message, but just make sure that it's tasteful.
Right. So
I'd also add one of the big challenges that written communication is very difficult to distinguish tone in. So you have to be extra cautious when you're sending instant messages or emails because, you know, they don't have that inflection that suggests you're joking, and people can read into that a lot differently, and it's a lot easier to miscommunicate now. And that's part of why we recommend video conferencing. You know, it's true what Dr. Alameda was saying, where when there's a mask in the way, you don't see that smile when the person kind of talks about something. You don't really see those nonverbal cues that let you know that they're not being, you know, aggressive. They're just suggesting something. They're joking around, and you need to be very cautious about how you communicate when it's purely in written format and there's no other context a lot of the time. So it helps to get back to more face-to-face engagement like this. And that's not to avoid legal issues. It's just to avoid the misconceptions or the miscommunications that happen, and that can drive wedges in some of those relationships. And that's been a big challenge, I think, for a lot of people.
I'm going to build on that by saying I'm an editor and I always edit what I write. So I would recommend that to everyone. I think people sometimes are in a hurry. They send, this is a really simple reply, and they send an email without rereading it to make sure, one, that it's clear, two, that it doesn't create all the problems that you talked about, the wrong tone, or even just not reading the message that came in very carefully, and you're responding to what you thought it said, not what it actually said. So a principle that I've heard much over my lifetime is go slow to go fast. If you go fast right from the beginning, you're actually going to take more time because of those miscommunications, and some of them can be huge and create monster problems. Take a moment, reread that email, or prepare in advance for an important meeting. That's another thing that helps prevent those problems from happening. So good things go slow to go fast. You know, a lot of people are thinking about technology and business, and we've talked about those personal connections that help us with all of those things, but it's evolving so fast, and things, it's impossible to predict the future. I think all of us 4 months ago would have thought the pandemic numbers would be way down. How can we plan and to maintain our customer relations, our employee relations, when we have no idea what the future really is? We think we know, but we're often wrong. And is there a role for technology in helping that planning process? And any thoughts from any of you?
You know, I think, you know, we've had those discussions lately around that because we see the numbers going up. But I think probably the one advantage that we have is we've been through it already. So we kind of know we're not where we were last year. It was just like, what are we going to do? Now, I think we just know what we need to do. We know where we need to ramp up in order, you know, if we do end up having more restrictions. And the other thing too is I think just the whole nature of work has changed. It's always, I think, going to have a component of being online and hybrid, working from home. So we will just continue to go down that roadmap of improving those technologies and giving people more access to make sure that they can work from home, you know, in the easiest way possible. So I think we're better prepared this time around, but you're right, you can't predict it. So you just got to do your best to try and stay ahead of it.
Jordan, do you see things on the horizon? You know, we've talked about cybercrime, we've talked about virtual meetings, we've talked about many different things. Is there, in the tech business, what is the industry thinking is around the corner? Obviously, AI is one of those things. Anything tell us about that, or any of the other things that you see coming?
Sure. I think, like Brian mentioned, it's work from home is more or less here to stay, right? Companies have realized that it's possible. Some were forced to realize they had to just do it, and there'll be levels of it going forward. Finding technologies to make that easier, to help build those relationships, to help keep people engaged, I think is what's going to be next. There's technology like AI that'll help with making workloads more efficient, maybe, but it won't replace a lot of what we do day to day. I think a lot of it is just about kind of revisiting the approach you took during the pandemic, maybe, and sort of tightening up that process, or seeing what worked and what didn't, keeping the stuff that worked and then improving on what didn't. And reaching out to partners. I mean, I'm obviously a little biased in that we are a provider, but reaching out with to organizations that specialize in implementing these types of solutions for businesses. I mean, let businesses be excellent at what they're excellent at, and we can be there to sort of help supplement that with a technology knowledge and help them implement tools that work and fit well for them, or that we've seen work well for others in their situation. And that's sort of what I see happening. We don't want every business in the world to have to be perfect at technology. We want to be there to help them, and they can continue to be great at what they're doing.
That's true. Yeah, for us, behavioral health has been big during this pandemic, and telebehavioral health has just skyrocketed, and it's going to be what we provide in the future. So, you know, we started off with most of our visits were inpatient, and now 80% of our behavioral health visits is actually virtual, and the patients like it better that way. And it's actually, and we're producing more that way as well. So the access to care has also increased. Instead of seeing, you know, 4 or 5 patients in a day, our behavioral health therapists can see 10 in a day, because it's just next, right? And so you don't have to wait. You don't have to go into the waiting room. They don't have to fill out paperwork. So that's going to stay for sure, regardless of what happens in the future.
It's by behavioral health, do you mean like a psychologist, psychiatrist talking?
Right. Behavioral health, mental health, social workers, that type. Yeah.
I think, I've often thought about that, when I've been under stress, when I'm feeling burnout approaching, I'd like to talk to someone. I haven't taken that step to doing it as telehealth. Is the experience as effective doing it over a virtual call as it is in person?
Yeah. Well, let's test it out. Steve. So how was your day today? No, it's kidding.
Well, I was preparing for this, so I've been busy, and
Right.
I'm feeling a little stressed, and my blood pressure is up a little bit because I've always, for an event, you want to do it really right and have the right energy and everything. So yes, I'm feeling under a little stress.
See, so it's that exchange. It can happen, man. It can happen in a virtual context as well. So it is possible, and thank goodness for this opportunity.
Thank you for that. Jordan, here's another question asking CBTS, Hawaiian Telecom, be able to give help resources on best practices for virtual communications. So if you sign up for a service, because we talked about best practices and we've talked a lot about virtual communication. We've mentioned a few things about how to make them effective. You make sure that you're giving all the cues that you would give in person. Do you share that with your customers, best practices for virtual communication?
We may have some stuff available, and if not, we definitely can probably come up with some stuff to help with that. I don't know offhand that we have something publicly published out there for it, but we definitely could.
Cool.
Yeah.
And here's a note from Matt with the CBTS saying that, yes, our account management team can connect with you with technology experts to have a conversation about your business, regardless of size, provide in-depth consulting. So go to that website and connect with them either by phone or pushing the contact us button. Here's another question. I'm going to look down at the bottom of my screen. What have your organizations done to provide management the tools and confidence to have conversations with their direct reports, to ask personal questions that may be uncomfortable, but necessary, especially in this work environment? Great question. Yes, difficult conversation because you're asking about someone's personal life, but you care about them and you do want to prevent that burnout. You want to reduce stress. So yes, those are difficult conversations. Let's start with Chemo because we were just talking about behavioral health. How do you have those difficult conversations, being respectful of the employee, but helping them deal with difficulties?
Yeah. So at our 10 clinics, we have what do you call it, a site manager, and so we kind of check in with the site manager. First of all, we pay attention to those employees who live alone. So if an employee lives alone, we kind of keep an eye on that. And or family that's not here, and part of our huddles. So that's what we do. Part of our weekly huddles is to check in on some of those patients. And how's so and so doing? I heard their parents left and she's living by herself now. Do a quick check in. And then there's signs of depression. So if somebody's calling in sick a lot, we try to follow up on that with a friend who's in the clinic who knows, that kind of thing, without intruding, because there's some HR restrictions too, right, when it comes to that kind of stuff. So we kind of feel it out, and I think having somebody at the site who knows that person the best, we kind of defer to them on best next steps. But yeah, we also do a Friday shout out. Every Friday I do a Aloha Friday shout out from the CEO, right? And in there I kind of highlight some coping tips, just making sure that resources available. Hey, if these are signs of burnout, and utilize. Unfortunately, we got therapists right in our clinic, so utilize our own mental health professionals. Don't be afraid, don't be ashamed. We're all in this together, kind of thing. So it's that approach that I think would work.
Excellent. Thank you for sharing. I just want to throw out another case where you might want to check in with people. My daughter was working from home for a year longer, and that was great. But recently she moved to the Bay Area because her company was about to start in-person work again. So it was a challenging time for me and my wife, and we got through it. But it was stressful for us, and yeah, it would have been great if someone had reached out, and some of my colleagues did at that time and help us through that difficult process. So sadly, we have run out of time. Thank you to our panel for a great discussion. Thank you to Cbts, Hawaiian Telecom, for sponsoring this webinar. Please reach out to them, go to their website, and they will help you solve your tech problems and maintain your connections with customers, employees, vendors, with all of those people you need to stay connected to. And mahalo to all of you for attending. I'm Steve Petranek. Aloha and have a great day.